Question 1. The investigation demonstrates that a veterinary surgical team is preparing for a complex orthopedic procedure on an equine patient. The team has a variety of surgical instruments, including delicate laparoscopic tools, stainless steel retractors, and rubber-shod instruments. The team's approach to ensuring instrument sterility involves a combination of cleaning methods and sterilization techniques. Which of the following approaches best reflects current best practices and regulatory expectations for maintaining aseptic technique in equine surgical settings? Option A. Relying solely on visual inspection of instruments after cleaning to confirm sterility, assuming that all instruments can withstand high-temperature autoclaving, and using a single sterilization cycle time for all loads regardless of size or content. Option B. Utilizing a rapid instrument washer disinfector for all instruments, followed by a chemical sterilization process that is not manufacturer recommended for certain delicate instruments, and only performing sterilization monitoring when an issue is suspected. Option C. Employing a general-purpose disinfectant for initial cleaning, followed by a cold sterilization solution for all instruments, regardless of material composition, and skipping the use of sterilization indicators to save time. Option D. Prioritizing the use of high-level disinfectants for all instruments that cannot be autoclaved, ensuring all instruments are visually inspected for debris after cleaning and before sterilization, and utilizing biological indicators for routine autoclave efficacy checks. The correct answer is D. Prioritizing the use of high-level disinfectants for all instruments that cannot be autoclaved, ensuring all instruments are visually inspected for debris after cleaning and before sterilization, and utilizing biological indicators for routine autoclave efficacy checks. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in equine surgical practice, ensuring the sterility of instruments to prevent surgical site infections. The challenge lies in the potential for subtle breaches in sterilization protocols to have significant consequences for patient outcomes, client trust, and the practice's reputation. Equine surgery often involves complex procedures in a field environment or specialized surgical suites, where maintaining aseptic technique can be more demanding than in small animal settings. The VTS equine specialist must possess a comprehensive understanding of various sterilization methods and their limitations to make informed decisions regarding instrument processing. Correct approach analysis. The correct approach emphasizes a multifaceted strategy that includes selecting appropriate sterilization methods based on instrument material and type, adhering strictly to manufacturer's instructions for use (IFU) for both cleaning and sterilization agents, and implementing robust quality control measures. This aligns with best practices in veterinary medicine, which are guided by principles of patient safety and infection control. Regulatory frameworks, such as those overseen by the American Veterinary Medical Association, AVMA, and state veterinary licensing boards, implicitly or explicitly mandate adherence to established standards of care, which include proper sterilization. Ethical considerations, particularly the duty to provide competent care and avoid harm, necessitate the highest standards in aseptic technique. Incorrect approaches analysis. One incorrect approach involves relying solely on visual inspection for sterility. This is a critical failure because many microorganisms are not visible to the naked eye, and contamination can occur even if instruments appear clean. This approach violates the fundamental principles of aseptic technique and directly compromises patient safety, potentially leading to infection. It demonstrates a lack of understanding of microbial contamination and the limitations of visual assessment, which is a failure in professional competence. Another incorrect approach is to assume that all sterilization methods are interchangeable and can be used on any instrument. This is a significant regulatory and ethical failure. Different sterilization methods, e.g., autoclaving chemical sterilization, have specific parameters and are suitable for different materials. Using an inappropriate method can damage instruments, render them non-sterile, or fail to kill all microorganisms. This demonstrates a lack of knowledge regarding instrument compatibility and sterilization efficacy, which is a breach of the standard of care and a failure to uphold the duty of competence. A third incorrect approach is to bypass or shorten sterilization cycles to save time. This is a direct violation of manufacturers' IFUs and established sterilization protocols. Sterilization cycles are validated to ensure adequate time and temperature/chemical exposure to achieve sterility. Shortening these cycles significantly increases the risk of incomplete sterilization, leading to potential patient infections. This represents a serious ethical lapse, as it prioritizes expediency over patient safety and a clear disregard for established protocols, which are often implicitly or explicitly supported by regulatory guidelines for infection control. Professional reasoning. Professionals should approach instrument sterilization with a systematic process. This begins with understanding the types of instruments being used and their material composition to select the most appropriate cleaning and sterilization method. Thoroughly reading and adhering to the manufacturer's IFUs for all cleaning agents, disinfectants, and sterilization equipment is paramount. Implementing a routine quality control program, which may include biological and chemical indicators, provides objective verification of the sterilization process. Regular review and updating of sterilization protocols based on current best practices and any relevant regulatory updates are also essential components of professional decision-making in this area. Question 2. Upon reviewing the diagnostic results of a critically ill equine patient presenting with lethargy, pale mucous membranes, and prolonged bleeding from a minor laceration, which blood component would be most critically assessed for potential administration to address both the anemia and the coagulopathy? Option A. Cryoprecipitate to specifically target fibrinogen deficiency and packed red blood cells for anemia. Option B. Whole blood to provide a broad range of cellular components and clotting factors. Option C. Platelet-rich plasma to improve clotting and albumin to increase oncotic pressure. Option D. Packed red blood cells to address the anemia and fresh frozen plasma to address the coagulopathy. The correct answer is D. Packed red blood cells to address the anemia and fresh frozen plasma to address the coagulopathy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of blood transfusions in equine medicine. Misinterpreting or misapplying knowledge about blood components and their functions can lead to severe patient harm, including transfusion reactions, ineffective treatment, and potentially fatal outcomes. The veterinarian's reliance on the technician's accurate assessment of blood component needs, based on the patient's clinical presentation and diagnostic findings, is paramount. The technician's role in identifying the specific deficit and recommending the appropriate component requires a deep understanding of hematology and transfusion medicine, directly impacting patient safety and treatment efficacy. Correct approach analysis. The correct approach involves a thorough risk assessment of the patient's condition to determine the most likely cause of the observed clinical signs and laboratory findings. This necessitates understanding the specific functions of various blood components. For instance, if the horse presents with severe anemia and coagulopathy, a risk assessment would consider the potential need for packed red blood cells to address oxygen-carrying capacity and fresh frozen plasma to correct clotting factor deficiencies. This approach aligns with best professional practice by prioritizing patient well-being and evidence-based medicine. It demonstrates a comprehensive understanding of how different blood components address specific physiological deficits, ensuring the most appropriate and safest therapeutic intervention is recommended. This is directly supported by the ethical obligation to provide competent care and the regulatory framework that mandates technicians to work within their scope of practice, which includes assisting in diagnostic and therapeutic decision-making based on their specialized knowledge. Incorrect approaches analysis. Recommending a broad-spectrum blood product without a clear understanding of the specific deficit represents a failure in risk assessment. For example, administering packed red blood cells solely based on a low packed cell volume, PCV, without considering other potential issues like clotting factor deficiencies would be an incomplete assessment. This could lead to a failure to address the underlying coagulopathy, potentially worsening the patient's condition or leading to uncontrolled hemorrhage. Ethically, this is a failure to provide appropriate care. Suggesting a blood product based on a single, isolated laboratory value without considering the overall clinical picture is another failure. For instance, recommending platelet-rich plasma solely because the platelet count is at the lower end of the reference range, without evidence of active bleeding or clinical signs of thrombocytopenia, is an oversimplification. This approach neglects the potential for other causes of bleeding or the possibility that the platelet count is clinically insignificant. This is a deviation from best practice, potentially leading to unnecessary procedures and costs, and failing to address the true underlying problem. Focusing on the most common blood component used in equine practice without a specific indication for the current patient is a significant risk. This approach relies on generalization rather than specific patient assessment. It ignores the unique physiological state of the individual horse and the specific diagnostic findings. This is a direct violation of the principle of individualized patient care and can lead to inappropriate treatment, potentially causing harm or failing to provide necessary support. This demonstrates a lack of critical thinking and a failure to apply specialized knowledge to the specific clinical scenario, which is a regulatory and ethical concern. Professional reasoning. Professionals should approach such scenarios by first performing a comprehensive risk assessment of the patient's clinical signs and diagnostic results. This involves identifying the most probable physiological derangements. Subsequently, they must correlate these derangements with the specific functions of various blood components. The decision-making process should then focus on selecting the blood product that directly addresses the identified deficit, thereby mitigating the identified risks. This systematic approach ensures that treatment is targeted, effective, and minimizes the risk of adverse events, aligning with both ethical obligations and regulatory expectations for competent veterinary care. Question 3. The audit findings indicate a pattern of the equine veterinary technician specialist questioning the veterinarian's prescribed treatment for a specific lameness case, specifically regarding the dosage and frequency of a non-steroidal anti-inflammatory drug, NSAID, that appears to exceed standard therapeutic ranges for the horse's weight and condition. The technician has concerns about potential gastrointestinal side effects and the long-term impact on renal function. The veterinarian has reiterated the directive to administer the medication as prescribed. What is the most appropriate course of action for the veterinary technician specialist? Option A. Express concerns to the veterinarian, requesting clarification on the rationale for the dosage and frequency, and proposing alternative considerations based on current literature and patient assessment, while emphasizing patient safety. Option B. Administer the medication as prescribed without further comment to avoid insubordination and maintain a harmonious working relationship with the veterinarian. Option C. Immediately refuse to administer the medication and inform the horse owner that the prescribed treatment is potentially harmful. Option D. Discuss the veterinarian's treatment plan and the technician's concerns with a colleague in a social setting outside of the veterinary practice. The correct answer is A. Express concerns to the veterinarian, requesting clarification on the rationale for the dosage and frequency, and proposing alternative considerations based on current literature and patient assessment, while emphasizing patient safety. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the conflict between a veterinarian's directive and the technician's ethical and regulatory obligations. The audit findings highlight a potential deviation from established protocols, raising concerns about patient welfare and professional accountability. The technician is faced with a situation where following a direct order might compromise patient care or violate established guidelines, necessitating a careful and principled response. Correct approach analysis. The correct approach prioritizes patient welfare and adherence to established veterinary medical standards and ethical guidelines. A veterinary technician specialist, VTS, in equine is expected to possess advanced knowledge and skills, including the ability to critically assess treatment plans and identify potential risks. By seeking clarification and expressing concerns about the proposed treatment's efficacy and potential harm, the technician upholds their professional responsibility to advocate for the patient. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it demonstrates a commitment to maintaining professional standards and ensuring that treatment decisions are evidence-based and appropriate for the specific clinical situation, as expected within the regulatory framework governing veterinary practice. Incorrect approaches analysis. One incorrect approach involves unquestioningly administering the medication as directed, despite reservations. This failure to critically evaluate the veterinarian's order and voice concerns constitutes a dereliction of the technician's professional duty. It could lead to patient harm if the medication is inappropriate or administered incorrectly, violating the principle of non-maleficence. Ethically, it bypasses the technician's role in patient advocacy and professional collaboration. Another incorrect approach is to immediately refuse to administer the medication without attempting to understand the veterinarian's rationale or seeking further information. While a technician has the right to refuse to perform an act they believe to be unethical or harmful, a complete refusal without communication can be seen as insubordinate and detrimental to the veterinarian-technician relationship and team-based care. It fails to explore collaborative problem-solving and may escalate the situation unnecessarily, potentially impacting the veterinarian's ability to provide timely care. A third incorrect approach is to discuss the veterinarian's treatment plan with the owner without first attempting to resolve the issue directly with the veterinarian or seeking appropriate channels for professional consultation. This breaches client confidentiality and professional boundaries. It undermines the veterinarian's authority and can create distrust within the veterinary team and with the client. The technician's role is to support the veterinarian's plan, not to independently communicate concerns about it to the client, especially without a clear understanding of the full clinical picture or having exhausted internal resolution methods. Professional reasoning. Professionals in veterinary medicine, particularly VTS, must employ a structured decision-making process when faced with ethical dilemmas. This involves 1. Identifying the ethical issue and relevant professional standards. 2. Gathering all pertinent information, including the clinical signs, diagnostic findings, and the proposed treatment plan. 3. Consulting with the supervising veterinarian to understand their rationale and express concerns clearly and professionally. 4. If concerns persist and cannot be resolved directly, seeking guidance from established protocols, practice policies, or senior colleagues. 5. Prioritizing patient welfare and acting in accordance with ethical principles and regulatory requirements. This systematic approach ensures that decisions are well-reasoned, defensible, and uphold the highest standards of professional conduct. Question 4. Examination of the data shows a 15-year-old quarter horse gelding residing on a farm with a history of occasional exposure to other horses at local shows. The owner expresses concern about the cost of vaccinations and asks for the most essential preventative measures. The horse has no known pre-existing health conditions. What is the most appropriate initial recommendation for this horse's preventative health care and vaccination protocol? Option A. Propose a comprehensive vaccination protocol that includes all available equine vaccines, regardless of the horse's specific risk factors or the owner's budget. Option B. Suggest vaccinating only for tetanus, as it is the most critical vaccine for horses with limited exposure. Option C. Recommend a core vaccination series including Eastern and Western equine encephalomyelitis, West Nile virus, rabies, and tetanus, along with influenza and strangles, explaining the rationale for each based on potential exposure and disease severity. Option D. Advise against vaccination due to the horse's age and limited exposure, suggesting instead a focus on general hygiene and parasite control. The correct answer is C. Recommend a core vaccination series including Eastern and Western equine encephalomyelitis, West Nile virus, rabies, and tetanus, along with influenza and strangles, explaining the rationale for each based on potential exposure and disease severity. Explanation. Scenario analysis. This scenario presents a common challenge in equine preventative health care, balancing established vaccination protocols with individual patient risk factors and owner concerns. The veterinarian must navigate potential disease outbreaks, the efficacy and limitations of vaccines, and the owner's specific financial and philosophical considerations. The professional challenge lies in providing evidence-based recommendations while respecting client autonomy and ensuring the horse's well-being. Correct approach analysis. Recommending a vaccination protocol tailored to the individual horse's lifestyle, geographic location, and exposure risk, while also discussing the rationale behind each vaccine and addressing the owner's concerns, represents best professional practice. This approach aligns with the principles of responsible veterinary medicine, emphasizing a proactive and individualized approach to disease prevention. It adheres to the ethical obligation to provide competent care and informed consent, ensuring the owner understands the benefits and risks associated with vaccination. This aligns with the general ethical guidelines for veterinary practice, which prioritize patient welfare and client education. Incorrect approaches analysis. Recommending a blanket, one-size-fits-all vaccination protocol without considering the horse's specific circumstances or the owner's input is professionally unacceptable. This fails to acknowledge the variability in disease risk and can lead to unnecessary vaccination or inadequate protection. It also undermines the client-doctor relationship by not engaging in shared decision-making. Suggesting that vaccination is entirely unnecessary due to the horse's limited exposure is also professionally unsound. While exposure is a factor, many equine diseases can be transmitted indirectly or through asymptomatic carriers. A complete disregard for established preventative measures without a thorough risk assessment is a failure of due diligence and can put the horse at significant risk. Focusing solely on the most common diseases without considering less prevalent but potentially devastating ones, or failing to discuss the core versus non-core vaccine distinctions, is also a deficiency. This limits the owner's ability to make a fully informed decision and may leave the horse vulnerable to preventable illnesses. Professional reasoning. Professionals should utilize a decision-making framework that begins with a comprehensive assessment of the patient's history, lifestyle, and environment. This should be followed by a discussion with the owner to understand their concerns, priorities, and financial constraints. The veterinarian should then present evidence-based recommendations for preventative health care, including vaccination, clearly explaining the rationale, benefits, and potential risks of each component. This collaborative approach ensures that the chosen protocol is both medically appropriate and aligned with the owner's capacity and preferences, ultimately prioritizing the horse's health and welfare. Question 5. Performance analysis shows a consistent pattern of suboptimal coat condition and reduced energy levels in a client's performance horse, despite the owner reporting feeding a commercially available all-purpose equine feed. The owner expresses concern about the cost of premium feeds and states they are looking for the most economical option that still gets the job done. As a VTS equine, you have identified potential deficiencies in key micronutrients and essential fatty acids based on the horse's workload and breed characteristics. The owner is asking for your recommendation for a feed that is significantly less expensive than the premium options you typically recommend for performance horses. What is the most ethically and professionally sound approach to addressing this situation? Option A. Advise the owner to simply increase the quantity of the current all-purpose feed, as this is the most economical way to potentially increase nutrient intake without changing the feed type. Option B. Recommend a scientifically formulated, cost-effective feed that meets the horse's specific nutritional requirements for its workload and breed, and clearly explain the rationale and benefits to the owner, offering to discuss alternative feeding strategies if budget remains a primary concern. Option C. Inform the owner that you cannot recommend any feed that is not a premium, high-cost option, as anything less would compromise the horse's health and performance, and they should consider if they can afford to properly care for the horse. Option D. Suggest the owner switch to a basic, low-cost grain mix and supplement with a general vitamin and mineral powder, as this is a common and inexpensive approach for many horse owners. The correct answer is B. Recommend a scientifically formulated, cost-effective feed that meets the horse's specific nutritional requirements for its workload and breed, and clearly explain the rationale and benefits to the owner, offering to discuss alternative feeding strategies if budget remains a primary concern. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a veterinary technician specialist, VTS, in equine. The challenge lies in balancing the owner's perceived needs and financial constraints with the horse's actual nutritional requirements for optimal health and performance, as dictated by scientific evidence and best practices. The VTS must navigate potential conflicts arising from differing opinions on what constitutes adequate nutrition, especially when financial limitations are a stated concern. This requires not only strong technical knowledge, but also excellent communication and ethical reasoning skills. Correct approach analysis. The correct approach prioritizes the horse's well-being and adherence to evidence-based nutritional science, aligning with the ethical principles of veterinary practice, which mandate acting in the best interest of the animal. This involves a thorough assessment of the horse's current diet, body condition, workload, and any underlying health issues. Based on this assessment, the VTS should formulate a scientifically sound, practical, and cost-effective nutritional plan. This plan should be communicated clearly to the owner, explaining the rationale behind the recommendations and offering alternatives that meet the horse's needs within a realistic budget. This approach upholds the VTS's professional responsibility to provide high-quality care and advice, grounded in scientific knowledge and ethical considerations. Incorrect approaches analysis. One incorrect approach involves immediately acquiescing to the owner's request for a cheaper, less nutrient-dense feed without a thorough assessment. This fails to uphold the VTS's duty of care to the horse. Ethically, it prioritizes the owner's immediate financial concern over the animal's long-term health, potentially leading to deficiencies and performance issues. This could be seen as a breach of professional standards if it results in substandard care. Another incorrect approach is to rigidly insist on the most expensive, premium feed without exploring cost-effective alternatives or understanding the owner's financial limitations. While well-intentioned, this can alienate the owner and make them less likely to follow any recommendations, ultimately harming the horse. It demonstrates a lack of practical problem-solving and empathy, failing to consider the holistic needs of the horse-owner relationship. A third incorrect approach is to provide generic, unverified nutritional advice without a specific assessment of the individual horse. This is unprofessional and potentially harmful, as nutritional needs are highly individualized. It bypasses the VTS's specialized knowledge and the ethical obligation to provide tailored, evidence-based recommendations. Professional reasoning. Professionals should approach such situations by first gathering all necessary information about the animal and its environment. This includes a comprehensive dietary history, physical examination, and understanding of the horse's intended use. Next, they should apply their specialized knowledge to identify any nutritional gaps or excesses. The crucial step is then to communicate these findings and recommendations clearly and empathetically to the owner, actively listening to their concerns and constraints. The goal is to collaboratively develop a plan that is both scientifically sound and practically achievable for the owner, always prioritizing the animal's welfare. This involves offering a range of options, explaining the pros and cons of each, and being prepared to justify recommendations with scientific evidence. Question 6. Cost-benefit analysis shows that altering the prescribed high-fiber, controlled starch diet for a performance horse to reduce daily feed costs by substituting a significant portion of forage with a less digestible, lower-quality grain could be financially advantageous for the owner in the short term. However, considering the complex digestive processes and specific enzyme functions within the equine gastrointestinal tract, what is the most professionally responsible course of action for the veterinary technician specialist? Option A. Advise the owner to consult a nutritionist for a less expensive diet plan, deferring the responsibility of dietary recommendations. Option B. Suggest a less expensive but still high-quality commercial feed that is specifically formulated for performance horses, emphasizing its balanced nutrient profile and digestibility without delving into specific enzyme functions. Option C. Explain to the owner the critical role of specific digestive enzymes and microbial populations in breaking down forage for energy and nutrient absorption, detailing how a sudden shift to a less digestible grain could overwhelm these systems, leading to potential colic, hindgut, and reduced nutrient availability, ultimately costing more in veterinary care and impacting performance. Option D. Agree to the owner's request to reduce feed costs, assuming the horse will adapt to the new diet over time, with minimal negative consequences. The correct answer is C. Explain to the owner the critical role of specific digestive enzymes and microbial populations in breaking down forage for energy and nutrient absorption, detailing how a sudden shift to a less digestible grain could overwhelm these systems, leading to potential colic, hindgut, and reduced nutrient availability, ultimately costing more in veterinary care and impacting performance. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in balancing the immediate financial concerns of a horse owner with the long-term health and welfare of the equine patient. The owner's desire to minimize costs by altering a prescribed dietary regimen, which directly impacts digestive processes and enzyme function, creates a conflict between economic expediency and veterinary best practice. The VTS must navigate this by providing clear, evidence-based information that educates the owner on the physiological consequences of their proposed changes, thereby upholding their ethical obligation to the animal's well-being. Correct approach analysis. The correct approach prioritizes the horse's physiological needs and the established scientific understanding of equine digestion. It involves a detailed explanation to the owner about how the specific digestive enzymes E, G, amylase, lipase, proteases, function at different stages of the digestive tract, and how altering the diet, particularly the timing or composition of feed, can disrupt the delicate balance of microbial fermentation in the hindgut. This explanation should highlight how a sudden change or omission of a component can lead to reduced nutrient absorption, potential for colic, laminitis, or other metabolic disturbances, all of which would ultimately incur greater veterinary costs and compromise the horse's quality of life. This aligns with the VTS's role in client education and advocating for the animal's health, adhering to the principles of responsible animal care and professional conduct expected within the veterinary field. Incorrect approaches analysis. One incorrect approach would be to simply agree to the owner's request without providing a thorough explanation of the potential consequences. This fails to uphold the VTS's duty of care and client education, potentially leading to iatrogenic harm to the horse. Ethically, this constitutes a dereliction of professional responsibility. Another incorrect approach would be to dismiss the owner's financial concerns entirely and rigidly insist on the original plan, without attempting to find a compromise or alternative that might be more financially feasible while still being physiologically sound. This could alienate the owner and damage the client-veterinarian relationship, hindering future compliance and care. It also fails to acknowledge the practical realities faced by horse owners. A third incorrect approach would be to offer a dietary change that is not scientifically supported for equine digestion, perhaps based on anecdotal evidence or trends, without understanding the specific enzymatic and microbial interactions involved. This risks misinforming the owner and causing harm, violating principles of evidence-based veterinary medicine. Professional reasoning. Professionals should approach such situations by first actively listening to the owner's concerns and understanding their financial constraints. Subsequently, they must leverage their specialized knowledge of equine digestive physiology and enzyme function to explain the risks and benefits of any proposed dietary modifications. The decision-making process involves 1. Assessing the potential impact of the owner's proposed change on the horse's digestive system and overall health. 2. Clearly communicating these potential impacts to the owner in an understandable manner. 3. Exploring alternative dietary strategies that might meet both the owner's financial needs and the horse's physiological requirements. And 4. Documenting all discussions and decisions made. The ultimate goal is to achieve a mutually agreeable plan that prioritizes the horse's welfare while respecting the owner's circumstances. Question 7. Analysis of a veterinary technician specialist, VTS, in equine practice performing a neurological examination on a horse presenting with ataxia. The VTS has identified specific deficits including proprioceptive deficits in the hind limbs, nystagmus, and facial nerve paralysis. The VTS is tasked with communicating these findings to the supervising veterinarian. Which of the following represents the most appropriate and professionally responsible method for the VTS to convey this information? Option A. Provide a list of the observed deficits without any interpretation or context, assuming the veterinarian will understand their significance. Option B. Inform the veterinarian that the horse likely has a specific neurological disease, such as equine protozoal myeloencephalitis, EPIM, based on the observed signs. Option C. State that the horse seems neurologically compromised and leave further assessment to the veterinarian. Option D. Present a detailed, objective summary of all neurological findings, including specific observations of gait abnormalities, cranial nerve deficits, and postural reaction deficits, to the veterinarian for their diagnostic interpretation. Correct answer is D. Present a detailed, objective summary of all neurological findings, including specific observations of gait abnormalities, cranial nerve deficits, and postural reaction deficits, to the veterinarian for their diagnostic interpretation. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the inherent complexity of equine neurological conditions and the critical need for accurate diagnostic interpretation. The veterinarian's reliance on the veterinary technician specialists, VTS, expertise in interpreting subtle neurological deficits is paramount. Misinterpretation can lead to delayed or incorrect diagnoses, impacting patient prognosis and owner expectations. The VTS must navigate the ethical imperative of providing accurate information while acknowledging the limitations of their role in definitive diagnosis, which rests with the veterinarian. Correct approach analysis. The correct approach demonstrates best professional practice by emphasizing the VTS's role as a skilled interpreter of objective findings and a communicator of these findings to the veterinarian. This aligns with the VTS's scope of practice, which includes advanced diagnostic support and patient monitoring. By presenting a detailed, objective summary of the neurological examination findings, including specific observations of gait abnormalities, cranial nerve deficits, and postural reactions, the VTS provides the veterinarian with the necessary data to formulate a differential diagnosis and treatment plan. This collaborative approach respects the veterinarian's ultimate diagnostic authority while leveraging the VTS's specialized knowledge. This adheres to the principles of professional conduct and patient care expected of a VTS, ensuring that diagnostic efforts are thorough and evidence-based. Incorrect approaches analysis. One incorrect approach involves the VTS offering a definitive diagnosis. This is a regulatory and ethical failure as it oversteps the VTS's scope of practice. The VTS is not licensed to diagnose. That responsibility lies solely with the licensed veterinarian. This action could lead to misdiagnosis, inappropriate treatment, and potential legal ramifications for both the VTS and the veterinary practice. Another incorrect approach is to provide a vague or incomplete summary of the neurological findings. This fails to meet the professional standard of care. A VTS is expected to possess advanced knowledge and skills in neurological assessment and interpretation. A superficial report deprives the veterinarian of crucial details needed for accurate diagnosis and treatment, potentially compromising patient welfare and violating ethical obligations to provide competent care. A third incorrect approach is to withhold objective findings from the veterinarian due to personal uncertainty about their significance. This is an ethical failure rooted in a lack of professional confidence or a misunderstanding of the VTS's role. The VTS's responsibility is to report all relevant observations, allowing the veterinarian to make the final interpretation. Failing to do so hinders the diagnostic process and potentially harms the patient. Professional reasoning. Professionals should utilize a decision-making framework that prioritizes objective data collection, accurate interpretation within their scope of practice, and clear, concise communication with the supervising veterinarian. This involves 1. Thoroughly performing and documenting all aspects of the neurological examination. 2. Objectively interpreting observed deficits based on advanced VTS knowledge. 3. Clearly and comprehensively communicating these findings to the veterinarian, highlighting any significant abnormalities. 4. Collaborating with the veterinarian to refine diagnostic and treatment strategies, always deferring definitive diagnosis and treatment decisions to the veterinarian. Question 8. Governance review demonstrates a need to refine the diagnostic protocols for equine neurological cases. A VTS equine specialist is presented with a horse exhibiting ataxia and muscle weakness. The specialist must determine the most effective initial approach to differentiate between a central nervous system lesion and a peripheral nervous system lesion to guide further diagnostics. Option A. Conduct a comprehensive neurological examination, systematically assessing cranial nerves, spinal reflexes, postural reactions, and gait to identify specific deficits that localize the lesion to either the central or peripheral nervous system. Option B. Administer empirical treatments for common neurological conditions based on the initial observation of ataxia and weakness, deferring a detailed neurological workup until treatment response is assessed. Option C. Immediately initiate advanced imaging of the brain and spinal cord without a detailed clinical neurological assessment, assuming the most common CNS pathologies. Option D. Focus solely on observing gross motor deficits and muscle atrophy, attributing the signs to generalized neuromuscular disease without attempting to differentiate CNS versus PNS involvement. The correct answer is A. Conduct a comprehensive neurological examination, systematically assessing cranial nerves, spinal reflexes, postural reactions, and gait to identify specific deficits that localize the lesion to either the central or peripheral nervous system. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of neurological assessments in equine patients. Misinterpreting or failing to accurately identify signs related to central versus peripheral nervous system dysfunction can lead to delayed or incorrect diagnoses, potentially impacting treatment efficacy and patient prognosis. The VTS equine specialist is expected to possess a high level of diagnostic acumen, requiring a nuanced understanding of neuroanatomy and its clinical manifestations. The challenge lies in applying this knowledge to a live patient, where subtle clinical signs can be indicative of significant underlying pathology. Correct approach analysis. The correct approach involves a systematic and thorough neurological examination, prioritizing the identification of specific deficits that localize to either the central nervous system, CNS, or peripheral nervous system, PNS. This aligns with best professional practice by ensuring a logical diagnostic pathway, by differentiating between upper motor neuron and lower motor neuron LMN signs, or by identifying cranial nerve deficits versus spinal cord lesions. The VTS equine specialist can effectively narrow down the differential diagnosis. This methodical approach is ethically sound as it prioritizes patient welfare through accurate diagnosis and treatment planning, and it adheres to the professional standards expected of a VTS, which implicitly require a deep understanding of comparative neuroanatomy and its clinical application. Incorrect approaches analysis. One incorrect approach involves focusing solely on gross motor deficits without attempting to differentiate between CNS and PNS origins. This is professionally unacceptable because it bypasses the critical step of localization, leading to a broad and potentially unmanageable list of differentials. Ethically, this can be considered a failure to provide competent care, as it does not leverage the specialist's advanced knowledge to refine the diagnostic process. Another incorrect approach is to attribute all neurological signs to a single, common condition without a comprehensive examination. This demonstrates a lack of critical thinking and a failure to consider alternative diagnoses. It is a deviation from best professional practice and can lead to misdiagnosis of more serious or treatable conditions, thus compromising patient welfare. A third incorrect approach is to rely solely on diagnostic imaging without a thorough clinical neurological assessment. While imaging is crucial, it should be guided by clinical findings. Without a proper neurological exam, imaging may be misinterpreted or may not target the most relevant areas, leading to unnecessary costs and delayed diagnosis. This approach fails to integrate clinical expertise with diagnostic tools, which is a hallmark of advanced veterinary practice. Professional reasoning. Professionals facing such a scenario should employ a structured decision-making process. This begins with a comprehensive history, followed by a systematic physical and neurological examination. During the neurological exam, the professional must actively attempt to localize the lesion by assessing reflexes, muscle tone, proprioception, and cranial nerve function, differentiating between CNS and PNS involvement. This localization guides the selection of further diagnostic tests, such as advanced imaging or cerebrospinal fluid analysis. Throughout the process, ethical considerations of patient welfare, owner communication, and resource management must be paramount. Question 9. Process analysis reveals that a VTS working in an equine referral hospital is presented with a horse exhibiting acute respiratory signs and fever. The horse has a history of recent travel to a large equestrian event. Considering the potential for highly contagious diseases, what is the most appropriate initial step in managing this case to mitigate risk to the hospital population and surrounding equine community? Option A. Proceed with standard diagnostic workup and treatment in the main treatment area, assuming the signs are likely due to a non-contagious condition, and address potential infectious disease concerns only if initial tests are positive. Option B. Restrict all diagnostic procedures and treatments until a definitive diagnosis of a non-infectious condition is confirmed to avoid unnecessary stress on the patient. Option C. Implement immediate isolation of the patient in a designated biosecure area and initiate diagnostic testing for common respiratory pathogens, while notifying the attending veterinarian of the potential infectious nature of the case. Option D. Immediately administer broad-spectrum antibiotics and supportive care in the main hospital ward to stabilize the patient, deferring any isolation or specific infectious disease testing until the horse is clinically improved. The correct answer is C. Implement immediate isolation of the patient in a designated biosecure area and initiate diagnostic testing for common respiratory pathogens, while notifying the attending veterinarian of the potential infectious nature of the case. Explanation. This scenario presents a professionally challenging situation due to the inherent risks associated with infectious diseases in equine populations. The veterinarian technician specialist, VTS, must balance the immediate need for diagnostic and therapeutic intervention with the critical responsibility of preventing disease spread, which has significant implications for animal welfare, economic stability of equine facilities, and public health. Careful judgment is required to implement biosecurity measures effectively without unduly compromising patient care or creating undue stress on the animal. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment. This involves systematically identifying potential hazards, e.g., specific infectious agents, routes of transmission, susceptible populations, evaluating the likelihood and severity of adverse outcomes, and determining appropriate control measures. This aligns with the ethical and regulatory obligations of veterinary professionals to uphold animal welfare and public health standards. Specifically, for a VTS in equine, this means adhering to established protocols for infectious disease management, which are often guided by organizations like the American Association of Equine Practitioners, AAEP, and state veterinary medical boards. A thorough risk assessment ensures that interventions are targeted, efficient, and minimize the potential for iatrogenic spread of disease, thereby fulfilling the duty of care. An incorrect approach that focuses solely on immediate treatment without considering biosecurity measures represents a significant regulatory and ethical failure. This could lead to the unwitting spread of highly contagious diseases like strangles or equine influenza, violating the VTS's responsibility to prevent harm and uphold public health. Such an oversight could result in outbreaks, leading to severe economic losses for owners and facilities, and potentially compromising the health of a wider equine population. Ethically, this demonstrates a lack of due diligence and a failure to act in the best interest of all animals and stakeholders. Another incorrect approach, which involves overzealous or unnecessary isolation protocols that impede essential diagnostic procedures or treatments, also constitutes a professional failure. While biosecurity is paramount, it must be balanced with the immediate medical needs of the affected animal. Unnecessary restrictions can delay critical care, negatively impacting the animal's prognosis and welfare. This demonstrates a misunderstanding of risk assessment, where control measures are not proportionate to the actual risk, potentially leading to patient harm. The professional reasoning process for similar situations should involve a structured approach to risk management. This begins with accurate identification of the potential infectious disease based on clinical signs, history, and signalment. Subsequently, a thorough assessment of the transmission pathways and the susceptibility of other animals in the environment is crucial. Based on this assessment, a tiered approach to biosecurity and treatment should be developed, prioritizing measures that are most effective in mitigating risk while remaining practical and minimally disruptive to patient care. Continuous reevaluation of the risk and the effectiveness of implemented measures is also essential, especially as new information becomes available or the clinical status of the patient changes. This systematic process ensures that decisions are evidence-based, ethically sound, and compliant with all relevant veterinary regulations and guidelines. Question 10. Research into the management of equine colic has highlighted the critical role of the veterinary technician specialist in early detection and assessment. A 15-year-old quarter horse gelding is presented to the equine hospital with a 4-hour history of intermittent pawing, rolling, and flank watching. Upon initial observation, the horse appears moderately uncomfortable, is intermittently lying down, and has a heart rate of 50 beats per minute, a respiratory rate of 24 breaths per minute, and pale mucous membranes. The veterinarian is en route. Which of the following actions best represents the immediate, appropriate role of the veterinary technician specialist in this scenario prior to the veterinarian's arrival? Option A. Begin a thorough gastrointestinal auscultation and abdominal palpation, documenting all findings meticulously. Option B. Administer a dose of phenylbutazone to alleviate pain and inflammation while awaiting the veterinarian. Option C. Place an intravenous catheter and administer a bolus of isotonic crystalloid fluid to address potential dehydration. Option D. Reassure the owner that colic is common and the horse will likely resolve with rest and observation. The correct answer is B. Administer a dose of phenylbutazone to alleviate pain and inflammation while awaiting the veterinarian. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in equine veterinary practice. A horse exhibiting signs of colic requires immediate and skilled assessment to differentiate between medical and surgical emergencies and to initiate appropriate treatment. The veterinary technician specialist, VTS, in equine plays a crucial role in this process, requiring a deep understanding of pathophysiology, diagnostic techniques, and treatment protocols, all while adhering to strict professional standards and ethical guidelines. The challenge lies in the rapid progression of colic, the potential for severe pain and compromise, and the need for accurate data collection to guide veterinary decision-making. Correct approach analysis. The correct approach prioritizes a systematic and thorough assessment of the patient, gathering comprehensive data that directly informs the veterinarian's diagnosis and treatment plan. This includes detailed observation of the horse's demeanor, vital signs, gastrointestinal auscultation findings, and palpation results. VTS's ability to accurately interpret these findings and communicate them effectively to the veterinarian is paramount. This approach aligns with the VTS credential's emphasis on advanced skills and knowledge in equine medicine, ensuring patient welfare and optimal outcomes. It reflects a commitment to evidence-based practice and the highest standards of veterinary care, as expected within the regulatory framework governing veterinary technicians. Incorrect approach is analysis. One incorrect approach might involve relying solely on a single diagnostic parameter, such as only checking heart rate, without a comprehensive assessment. This is a regulatory and ethical failure, because it demonstrates a lack of thoroughness and a failure to gather sufficient data to support veterinary decision-making, potentially leading to delayed or incorrect diagnoses and treatments. It falls short of the expected standard of care for a VTS. Another incorrect approach could be to administer pain medication without consulting the veterinarian or understanding the potential impact on diagnostic findings. This is a significant ethical and regulatory failure. It constitutes practicing veterinary medicine without a license, as pain management decisions in a colic case are within the veterinarian's purview. Furthermore, masking pain can obscure critical diagnostic clues, hindering the veterinarian's ability to accurately assess the severity and nature of the colic. A third incorrect approach might be to dismiss subtle but significant clinical signs, such as a slight change in gut sounds or a mild elevation in heart rate, as insignificant. This demonstrates a failure to recognize the potential seriousness of even early signs of colic and a lack of the advanced diagnostic acumen expected of a VTS. Ethically, it represents a dereliction of duty to advocate for the patient's well-being and can lead to delayed intervention, with potentially dire consequences. Professional reasoning. When faced with a colic case, a VTS should follow a structured decision-making process. 1. Initial assessment. Immediately assess the horse's general condition, demeanor, and vital signs. 2. Data collection. Systematically gather all relevant diagnostic information, including auscultation, palpation, and any other indicated diagnostics. 3. Communication. Clearly and concisely report all findings to the veterinarian, highlighting any abnormalities or concerning trends. 4. Treatment support. Assist the veterinarian with treatments and monitoring, ensuring all interventions are performed according to veterinary direction and established protocols. 5. Ongoing monitoring. Continuously reassess the patient's condition and report any changes promptly. This systematic approach ensures comprehensive patient care and upholds professional and ethical responsibilities. Question 11. The evaluation methodology shows that a 3-day-old foal presents with severe diarrhea, lethargy, and signs of dehydration following a suspected septicemic episode. The foal has been receiving intravenous fluids and antibiotics for 24 hours and is now showing some improvement in mentation, but remains anorctic. Considering the foal's critical condition and the potential for refeeding syndrome, which nutritional strategy represents the most appropriate and ethically sound approach for initiating enteral feeding? Option A. Gradually introduce small volumes of a highly digestible, low-lactose milk replacer or mare's milk, administered via nasogastric tube, and closely monitor for signs of gastrointestinal intolerance and metabolic disturbances. Option B. Withhold all enteral feeding until the foal is fully ambulatory and shows a strong interest in nursing. Option C. Immediately begin feeding a standard, high-fiber equine diet in larger volumes to ensure adequate caloric intake for recovery. Option D. Administer a high-energy, concentrated feed supplement orally, assuming the foal's digestive system will adapt quickly to the increased nutrient load. The correct answer is A. Gradually introduce small volumes of a highly digestible, low-lactose milk replacer or mare's milk, administered via nasogastric tube, and closely monitor for signs of gastrointestinal intolerance and metabolic disturbances. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist, VTS, to balance the immediate needs of a critically ill foal with the long-term nutritional implications of its recovery. The foal's compromised gastrointestinal function presents a complex nutritional puzzle, demanding a nuanced approach that avoids oversimplification. The VTS must consider not only the caloric and macronutrient needs, but also the specific micronutrient requirements and the potential for refeeding syndrome, all within the context of the equine species' unique physiology. This necessitates a deep understanding of equine nutrition, disease processes, and the ethical imperative to provide the highest standard of care. Correct approach analysis. The correct approach prioritizes a gradual, controlled reintroduction of nutrients, starting with highly digestible, low-volume feeds, and progressively increasing the quantity and complexity as the foal tolerates it. This strategy directly addresses the risk of refeeding syndrome, a potentially fatal metabolic complication that can occur when severely malnourished individuals are fed too aggressively. By monitoring the foal's clinical signs, vital signs, and electrolyte balance closely, the VTS can make informed adjustments to the feeding plan, ensuring a safe and effective nutritional recovery. This aligns with best professional practice by adhering to established veterinary nutritional guidelines for critically ill foals and demonstrating a commitment to patient safety and well-being, which are paramount ethical considerations in veterinary medicine. Incorrect approaches analysis. One incorrect approach involves immediately initiating a high-volume feeding regimen of a standard, high-fiber equine diet. This fails to account for the foal's compromised digestive capacity and significantly increases the risk of refeeding syndrome, potentially leading to severe electrolyte imbalances, cardiac arrhythmias, and even death. This approach demonstrates a lack of understanding of critical care nutrition and violates the ethical duty to avoid harm. Another incorrect approach is to withhold all feeding until the foal appears clinically stable, assuming it will recover spontaneously. This ignores the foal's immediate energy and nutrient requirements for healing and immune function. Prolonged starvation can exacerbate muscle wasting, impair wound healing, and compromise the immune system, ultimately hindering recovery. This approach represents a failure to provide necessary supportive care and a disregard for the foal's nutritional needs during a critical illness. A third incorrect approach is to rely solely on the owner's anecdotal experience or general equine feeding advice, without a thorough assessment of the foal's specific condition and nutritional status. While owner input is valuable, it cannot replace the specialized knowledge and diagnostic capabilities of a veterinary professional, especially in complex cases. This approach risks misinterpreting the foal's needs and implementing an inappropriate feeding strategy, which could be detrimental to its health. Professional reasoning. Professionals should approach this scenario by first conducting a comprehensive assessment of the foal's nutritional status, including body condition score, hydration, and any signs of gastrointestinal dysfunction. This should be followed by a risk assessment for refeeding syndrome. Based on this assessment, a tailored gradual feeding plan should be developed, prioritizing highly digestible, nutrient-dense feeds in small, frequent meals. Close monitoring of the foal's response to feeding, including clinical signs, vital parameters, and relevant laboratory values, e.g. electrolytes, glucose, is crucial for making timely adjustments. This systematic, evidence-based approach ensures optimal patient outcomes and upholds the highest ethical and professional standards. Question 12. Governance review demonstrates a need for enhanced diagnostic precision in equine patients presenting with suspected spinal cord lesions affecting hind limb function. A VTS equine is tasked with developing a protocol for differentiating between upper and lower motor neuron deficits. Which of the following diagnostic strategies best reflects an understanding of neurotransmission and reflex arcs to achieve this differentiation? Option A. Administering broad-spectrum anti-inflammatory medications and observing for subjective improvement in hind limb coordination. Option B. A comprehensive neurological examination that systematically assesses proprioception, muscle tone, and specific reflex responses, e.g., patellar, withdrawal, perineal, correlating findings with known neuroanatomical pathways and the role of neurotransmitters at neuromuscular junctions and within the central nervous system. Option C, performing diagnostic imaging of the entire vertebral column without a preceding detailed neurological assessment to guide the imaging focus. Option D, relying primarily on visual assessment of gait abnormalities and palpation of affected musculature to identify areas of weakness or atrophy. Correct answer is B, a comprehensive neurological examination that systematically assesses proprioception, muscle tone, and specific reflex responses, e.g., patellar, withdrawal, perineal, correlating findings with known neuroanatomical pathways and the role of neurotransmitters at neuromuscular junctions and within the central nervous system. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of neurological assessment in equine patients and the potential for misinterpretation of reflex responses. A governance review highlighting a need for improved diagnostic accuracy in cases of suspected spinal cord injury necessitates a deep understanding of neurotransmission and reflex arcs to ensure appropriate and timely intervention. The challenge lies in differentiating subtle neurological deficits from normal variations and ensuring that diagnostic and therapeutic decisions are based on sound physiological principles, adhering to the highest standards of veterinary care as expected within the VTS equine framework. Correct approach analysis. The correct approach involves a systematic evaluation of the horse's neurological status, focusing on identifying specific deficits that correlate with the suspected location of the lesion within the central or peripheral nervous system. This includes a thorough assessment of proprioception, motor function, and sensory responses, paying close attention to the integrity of various reflex arcs. For example, evaluating the patellar reflex, withdrawal reflexes, and perineal reflex, and understanding the afferent and efferent pathways, as well as the neurotransmitters involved, e.g., acetylcholine at the neuromuscular junction, is crucial. This approach aligns with the VTS equine's commitment to evidence-based practice and the application of advanced knowledge in specialized areas, ensuring that diagnostic conclusions are robust and lead to effective treatment plans. Adherence to established protocols for neurological examination and interpretation of findings is paramount. Incorrect approaches analysis. One incorrect approach would be to rely solely on gross observation of gait abnormalities without a detailed neurological examination. This fails to account for the complex interplay of neuronal pathways and neurotransmission that underlie normal locomotion. It could lead to misdiagnosis, delaying appropriate treatment for underlying neurological conditions, and potentially violating the VTS equine's ethical obligation to provide competent and thorough care. Another incorrect approach would be to administer empirical treatments for neurological conditions without a definitive diagnosis based on a comprehensive neurological assessment. This bypasses the critical step of understanding the specific neurotransmission and reflex arc dysfunction, potentially leading to ineffective treatment, adverse drug reactions, and a failure to address the root cause of the problem. This demonstrates a lack of adherence to the scientific principles underpinning veterinary neurology and a disregard for the VTS equine's role in advanced diagnostics. A third incorrect approach would be to attribute all hind limb ataxia to a single, common cause without considering the differential diagnoses that involve various parts of the reflex arc and neurotransmitter systems. This oversimplification ignores the intricate nature of the nervous system and the potential for lesions at different levels, from the spinal cord to peripheral nerves and muscles. Such an approach would be a failure to apply the depth of knowledge expected of a VTS and could result in significant diagnostic and therapeutic errors. Professional reasoning. Professionals should approach such scenarios by first establishing a baseline of normal neurological function in equines. When abnormalities are suspected, a systematic top-down neurological examination should be performed, starting with mental status and cranial nerves, progressing to spinal reflexes, gait analysis, and proprioception. Understanding the specific afferent and efferent pathways, interneurons, and neurotransmitters involved in each reflex arc is essential for localizing lesions. This systematic approach, combined with a thorough understanding of neuroanatomy and physiology, allows for accurate diagnosis and the development of targeted treatment strategies, fulfilling the professional and ethical obligations of a VTS equine. Question 13. Which approach would be most appropriate for a veterinary technician specialist, VTS, in equine emergency and critical care presented with a horse exhibiting signs of acute colic, lethargy, and elevated rectal temperature, suggestive of septic shock? Option A. Focus solely on pain management and supportive care, as the prognosis for septic shock in equines is often poor. Option B. Initiate aggressive intravenous fluid resuscitation. Administer broad-spectrum antibiotics, provide appropriate analgesia, and commence continuous vital sign monitoring. Option C. Delay fluid therapy until the specific causative agent of the suspected infection is identified through advanced diagnostics. Option D. Administer pain medication to alleviate discomfort while awaiting further diagnostic imaging to determine the cause of the colic. The correct answer is B. Initiate aggressive intravenous fluid resuscitation, administer broad-spectrum antibiotics, provide appropriate analgesia, and commence continuous vital sign monitoring. Explanation. Scenario analysis. This scenario presents a critically ill equine patient with suspected sepsis, a life-threatening condition requiring rapid and accurate assessment and intervention. The challenge lies in the dynamic nature of sepsis, the potential for rapid deterioration, and the need to balance aggressive treatment with patient comfort and owner communication, all within the constraints of available resources and established veterinary protocols. The veterinarian technician specialist, VTS, in equine emergency and critical care must synthesize complex information, anticipate complications, and execute a treatment plan efficiently and ethically. Correct approach analysis. The correct approach prioritizes immediate stabilization and diagnostic workup to identify the underlying cause of sepsis and guide targeted therapy. This aligns with best practices in emergency and critical care, emphasizing a systematic and evidence-based approach. Prompt administration of intravenous fluids, broad-spectrum antibiotics, and analgesia, coupled with continuous monitoring of vital signs and response to treatment, are crucial for improving outcomes in septic equines. This approach reflects the VTS's advanced knowledge and skills in managing complex cases, adhering to established veterinary medical guidelines and ethical principles of patient care. Incorrect approaches analysis. One incorrect approach would be to delay aggressive fluid therapy while awaiting definitive diagnostic results. This failure to initiate prompt resuscitation can lead to irreversible shock and organ damage, violating the ethical duty to provide timely and appropriate care. Another incorrect approach would be to administer pain medication without addressing the underlying sepsis, which, while providing symptomatic relief, does not treat the root cause and could mask worsening signs of infection, potentially leading to a delayed diagnosis and treatment of the primary issue. Furthermore, a failure to continuously monitor vital signs and patient response would represent a significant lapse in professional responsibility, as it prevents timely adjustments to the treatment plan and early detection of complications, contravening established standards of critical care. Professional reasoning. Professionals should employ a structured approach to emergency cases, beginning with a rapid primary survey to identify life-threatening conditions, followed by a more thorough secondary survey and diagnostic workup. This framework involves prioritizing interventions based on their immediate impact on patient survival and stability. Continuous reassessment of the patient's condition and response to treatment is paramount, allowing for dynamic adjustments to the therapeutic plan. Open and honest communication with the owner regarding the patient's prognosis, treatment options, and associated costs is an integral part of ethical veterinary practice. Question 14. The review process indicates a VTS in equine is presented with a horse exhibiting mucopurulent nasal discharge, fever, and enlarged submandibular lymph nodes. The horse has recently been in contact with other horses at a multi-equine facility. What is the most appropriate immediate course of action? Option A. Isolate the horse immediately, implement strict biosecurity protocols, and collect diagnostic samples for laboratory analysis. Option B. Continue normal stabling and management practices until laboratory confirmation of the suspected disease is received. Option C. Administer broad-spectrum antibiotics to control potential secondary bacterial infections while awaiting diagnostic results. Option D. Focus solely on symptomatic treatment for the fever and discharge, deferring further diagnostic steps. The correct answer is A. Isolate the horse immediately, implement strict biosecurity protocols, and collect diagnostic samples for laboratory analysis. Explanation: the review process indicates a scenario where a veterinary technician specialist, VTS, in equine is presented with a horse exhibiting signs suggestive of strangles. This situation is professionally challenging due to the highly contagious nature of Streptococcus equi subspecies equi*, the causative agent of strangles. Rapid and accurate diagnosis, coupled with appropriate biosecurity measures, is paramount to prevent widespread outbreaks within a facility and to protect other equine populations. The VTS must exercise sound judgment in initiating diagnostic protocols and implementing containment strategies while awaiting definitive laboratory confirmation. The correct approach involves immediate implementation of strict biosecurity protocols, including isolation of the affected horse, meticulous disinfection of the environment and equipment, and careful handling of the horse to prevent fomite transmission. Concurrently, prompt diagnostic sample collection, nasal swabs, guttural pouch washes, for laboratory analysis, PCR bacterial culture, is essential for definitive diagnosis. This approach represents best professional practice by prioritizing disease control and client communication, aligning with established veterinary guidelines for managing highly contagious diseases. It demonstrates adherence to the VTS's ethical responsibility to protect animal health and welfare, and to prevent the spread of zoonotic or economically significant diseases. An incorrect approach of delaying isolation and biosecurity measures until laboratory confirmation is received is a significant regulatory and ethical failure. This delay directly contravenes the principle of acting proactively to prevent disease spread, potentially leading to an outbreak. It also fails to uphold the VTS's duty of care to other animals and clients. Another incorrect approach, such as administering broad-spectrum antibiotics without diagnostic confirmation, is also professionally unacceptable. While seemingly helpful, it can mask clinical signs, hinder definitive diagnosis by affecting bacterial culture results, and contribute to antimicrobial resistance, all of which are contrary to responsible veterinary practice and ethical considerations. Furthermore, failing to inform the attending veterinarian and the client promptly about the suspected diagnosis and the necessary immediate actions constitutes a breach of communication protocols and a failure to act in the best interest of the patient and the facility. Professionals should employ a decision-making framework that prioritizes risk assessment and immediate action for highly contagious diseases. This involves recognizing the clinical signs suggestive of a specific disease, understanding its transmission routes and potential impact, and initiating appropriate containment and diagnostic measures without undue delay. Clear and consistent communication with the attending veterinarian and the client is crucial throughout the process. Question 15. The analysis reveals that a 15-year-old quarter horse gelding, presented for routine dental floating, is exhibiting increased vigilance, ear flicking, and a tense top line, despite no overt signs of pain or distress during initial palpation. The veterinary technician specialist is tasked with assessing the horse's behavioral state to inform the procedure, which approach best guides the technician's impact assessment and subsequent actions. Option A. Proceed with the dental floating as scheduled, assuming the observed behaviors are typical for a horse undergoing routine handling and do not require further investigation. Option B. Focus solely on the immediate task of dental floating, interpreting the horse's behavior as a minor inconvenience that can be managed through firm handling. Option C. Conduct a detailed behavioral observation, considering the horse's environment, recent history, and subtle physiological cues, to formulate a comprehensive understanding of its cognitive and emotional state before proceeding with the dental procedure. Option D. Immediately administer a mild sedative to reduce the horse's vigilance and allow for a smoother dental procedure without further behavioral assessment. Correct answer is C. Conduct a detailed behavioral observation, considering the horse's environment, recent history, and subtle physiological cues, to formulate a comprehensive understanding of its cognitive and emotional state before proceeding with the dental procedure. Explanation: this scenario presents a professional challenge due to the inherent variability in equine behavior and the potential for misinterpretation of subtle cognitive cues. A veterinary technician specialist, VTS, in equine must possess a deep understanding of ethology to ensure patient welfare and safety, as well as the safety of handlers and themselves. The impact assessment requires a nuanced approach that considers the horse's history, environment, and the specific context of the interaction. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the horse's behavioral state. This aligns with the ethical imperative to provide the highest standard of care and to act in the best interest of the animal. It also reflects the VTS's specialized knowledge in equine behavior, which is crucial for accurate diagnosis and treatment planning. Adhering to established protocols for behavioral assessment, which often involve observation, environmental evaluation, and consideration of physiological indicators, is paramount. This methodical approach minimizes the risk of misdiagnosis or inappropriate intervention, thereby safeguarding the horse's well-being and preventing potential escalation of stress or fear. An incorrect approach that relies solely on anecdotal evidence or personal assumptions about the horse's temperament fails to meet the professional standards expected of a VTS. This could lead to misjudgments about the horse's pain level, anxiety, or potential for aggression, resulting in inadequate pain management or an increased risk of injury. Such an approach may also violate ethical guidelines that mandate a thorough and objective evaluation of the patient. Another incorrect approach that focuses exclusively on the immediate task without considering the broader behavioral context overlooks the interconnectedness of a horse's environment and its cognitive state. This can lead to interventions that inadvertently exacerbate stress or fear, hindering diagnostic procedures or treatment efficacy. Ethically, this demonstrates a lack of diligence in ensuring the horse's comfort and minimizing distress, which is a core responsibility of a VTS. A professional decision-making process for similar situations should involve a systematic approach. First, gather all available historical information about the horse's behavior and medical history. Second, conduct a thorough, objective observation of the horse in its current environment, noting posture, vocalizations, and movement patterns. Third, consider potential underlying causes for the observed behavior, including pain, fear, or environmental stressors. Fourth, consult with the attending veterinarian to discuss findings and formulate a collaborative plan. And finally, continuously reassess the horse's response to interventions and adjust the plan as needed. This iterative process ensures that decisions are informed, ethical, and patient-centered. Question 16. Strategic planning requires a thorough understanding of how to best assess gas exchange in a critically ill equine patient presenting with acute respiratory distress. Considering the VTS equine scope of practice and the principles of respiratory physiology, which of the following approaches offers the most comprehensive and clinically relevant evaluation of gas exchange? Option A. Observing mucous membrane color and capillary refill time, as these reflect peripheral perfusion. Option B. Performing arterial blood gas analysis and assessing thoracic auscultation findings. Option C. Relying solely on the horse's respiratory rate and effort, as these are direct indicators of breathing. Option D. Monitoring rectal temperature and heart rate, as these can be affected by oxygenation status. The correct answer is C. Relying solely on the horse's respiratory rate and effort, as these are direct indicators of breathing. Explanation. The scenario presents a professionally challenging situation because it requires the equine veterinary technician specialist, VTS, to critically evaluate different methods of assessing gas exchange in a critically ill horse. The challenge lies in understanding the nuances of each method, their limitations, and their applicability in a real-time clinical setting, all while adhering to the highest standards of patient care and professional conduct as defined by the VTS equine regulatory framework. Careful judgment is required to select the most appropriate and informative diagnostic approach. The correct approach represents best professional practice because it prioritizes a comprehensive and accurate assessment of gas exchange, which is fundamental to managing respiratory distress in horses. This approach aligns with the VTS equine's commitment to evidence-based medicine and the ethical imperative to provide optimal patient care. By considering multiple facets of gas exchange, the VTS can make more informed therapeutic decisions, leading to improved patient outcomes and fulfilling their professional responsibilities. An incorrect approach that relies solely on a single, potentially less sensitive indicator of gas exchange would represent a regulatory and ethical failure. This failure stems from a deviation from best practices in diagnostic interpretation and a potential compromise of patient welfare due to incomplete or misleading information. For instance, relying only on subjective respiratory rate without objective blood gas analysis could lead to delayed or inappropriate interventions, violating the VTS's duty of care. Another incorrect approach might involve using outdated or unvalidated techniques, which would be a failure to uphold the professional standards of the VTS equine credential. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical signs, a thorough understanding of the available diagnostic tools and their limitations, and a consideration of the specific clinical context. The VTS should consult relevant literature and guidelines, collaborate with the attending veterinarian, and prioritize methods that provide the most accurate and actionable information for patient management. This iterative process ensures that decisions are grounded in sound scientific principles and ethical considerations. Question 17. The monitoring system demonstrates a significant and sustained drop in mean arterial blood pressure in a postoperative equine patient, despite the owner expressing a desire to discharge the horse immediately due to financial concerns and a perceived lack of visible distress. The VTS equine specialist is aware that this hypotension could indicate hypovolemia, cardiac compromise, or systemic inflammatory response syndrome, all of which require immediate intervention. Option A. Proceed with discharge as requested by the owner, assuming the horse will recover uneventfully and that financial constraints are the primary concern. Option B. Advocate for immediate further diagnostic workup and stabilization of the patient, explaining the physiological implications of the hypotension and the potential risks of discharge to the attending veterinarian and owner. Option C. Recommend immediate euthanasia based solely on the owner's financial concerns and the single abnormal physiological parameter, without further investigation. Option D. Administer a mild sedative to calm the owner and then proceed with discharge, deferring further monitoring to the owner's discretion. The correct answer is B. Advocate for immediate further diagnostic workup and stabilization of the patient, explaining the physiological implications of the hypotension and the potential risks of discharge to the attending veterinarian and owner. Explanation. This scenario presents a professional challenge due to the inherent conflict between immediate client wishes and the veterinarian's ethical and professional obligation to provide the best possible care based on objective physiological data. The veterinarian's duty of care, as defined by veterinary practice acts and professional codes of conduct, mandates acting in the animal's best interest, even when it conflicts with the owner's immediate desires. The VTS equine specialist is expected to possess advanced knowledge of equine anatomy and physiology, enabling them to interpret complex monitoring data and advocate for evidence-based treatment. The correct approach represents best professional practice because it prioritizes the patient's well-being by advocating for further diagnostic investigation and treatment based on objective physiological findings. This aligns with the core ethical principles of veterinary medicine, including beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, it upholds the VTS's responsibility to apply advanced knowledge to patient care and to communicate effectively with the veterinarian and owner regarding the patient's condition and prognosis. This approach is supported by the General Ethical Guidelines for Veterinary Professionals, which emphasize informed consent, patient advocacy, and the veterinarian's ultimate responsibility for patient management. An incorrect approach that dismisses the monitoring data and proceeds solely based on the owner's request would represent a failure to uphold the veterinarian's duty of care. This could be considered a breach of professional conduct by neglecting to act on critical physiological indicators of distress or deterioration. It fails to exercise the specialized knowledge expected of a VTS equine, potentially leading to patient harm and a violation of the principle of non-maleficence. Furthermore, it could be seen as a failure to obtain truly informed consent from the owner, as the owner is not being fully apprised of the patient's objective physiological status. Another incorrect approach, such as immediately recommending euthanasia without further investigation, would also be ethically problematic. While euthanasia can be a humane option, it should be based on a thorough assessment of the patient's prognosis and quality of life, not solely on a single physiological parameter or owner request, without exploring all diagnostic and therapeutic avenues. This would fail to demonstrate due diligence and could be seen as a premature abandonment of the patient. The professional decision-making process for similar situations should involve a systematic approach. 1. Objective assessment of all available data, including physiological monitoring, clinical signs, and diagnostic results. 2. Consideration of the patient's anatomy and physiology to interpret the significance of the data. 3. Open and honest communication with the owner, explaining the findings, potential diagnoses, treatment options, and prognoses, including the risks and benefits of each. 4. Collaborative decision-making with the owner, while maintaining professional responsibility for recommending the most appropriate course of action for the patient's welfare. 5. Documentation of all findings, discussions, and decisions. Question 18. During the evaluation of a severely injured horse that has sustained a deep laceration to the hind limb with significant active bleeding, what is the absolute priority in basic first aid procedures before the veterinarian arrives? Option A. Apply direct pressure and a pressure bandage to control hemorrhage. Option B. Attempt to clean the wound with antiseptic solution before applying any dressing. Option C. Thoroughly document the horse's medical history and the circumstances of the injury. Option D. Administer pain medication to alleviate the horse's distress. The correct answer is A. Apply direct pressure and a pressure bandage to control hemorrhage. Explanation. Scenario analysis. This scenario presents a common but potentially critical situation where a veterinary technician must act quickly and decisively with limited information. The challenge lies in recognizing the urgency, prioritizing immediate actions based on basic first aid principles, and understanding the limitations of their role in a pre-veterinarian assessment. The potential for rapid deterioration in an equine patient necessitates a structured, evidence-based approach to first aid. Correct approach analysis. The correct approach prioritizes immediate life-saving interventions and stabilization while awaiting veterinary assessment. This aligns with the core principles of veterinary nursing and the VTS scope of practice, which includes providing emergency care and stabilization under veterinary supervision, specifically addressing airway, breathing, and circulation. The ABCs of emergency care is paramount. Controlling hemorrhage is a critical first aid step to prevent hypovolemic shock. This approach reflects a thorough understanding of basic equine physiology and the immediate needs of a trauma patient, adhering to the ethical obligation to provide competent care and prevent further harm. Incorrect approach is analysis. One incorrect approach involves delaying critical interventions to gather extensive historical data. While history is important, in an acute trauma situation, immediate stabilization takes precedence. Failing to address life-threatening hemorrhage or airway compromise while seeking detailed history could lead to irreversible damage or death, violating the ethical duty of care and potentially falling short of the expected standard of practice for a VTS. Another incorrect approach is to administer medications without a veterinary diagnosis or specific instruction. While a VTS may administer medications under veterinary direction, initiating drug therapy in an emergency without that direction is outside the scope of basic first aid and could be detrimental, masking symptoms or causing adverse reactions. This constitutes a significant ethical and regulatory breach, as it bypasses veterinary oversight and diagnostic processes. A third incorrect approach is to focus solely on comfort measures without addressing immediate life threats. While comfort is a component of care, it is secondary to stabilizing critical physiological functions in an emergency. Neglecting to control bleeding or ensure a patent airway in favor of simply providing a calm environment would be a failure to provide adequate emergency first aid, potentially leading to a worse outcome for the patient. Professional reasoning. In any emergency situation, a veterinary professional must employ a systematic approach. This begins with a rapid assessment of the patient's overall condition, focusing on immediate threats to life. The ABC approach, airway, breathing, circulation, is a universal emergency protocol. For equine trauma, controlling external hemorrhage is a critical component of circulation. Once immediate life threats are addressed, further assessment and intervention can proceed. The VTS must always operate within their defined scope of practice, recognizing when to stabilize and when to defer to the veterinarian for diagnosis and definitive treatment. This decision-making process is guided by established veterinary emergency protocols, ethical guidelines, and regulatory frameworks governing veterinary practice. Question 19. Process analysis reveals that when presented with an equine patient exhibiting moderate hind limb lameness, a veterinary technician specialist, VTS, equine must determine the most appropriate initial diagnostic technique, Considering the principles of efficient and effective veterinary care, which of the following diagnostic approaches represents the most prudent and professionally sound course of action? Option A. Proceed directly to ultrasound examination of the superficial digital flexor tendon and suspensory ligament, as these are common sites of injury. Option B. Rely exclusively on radiography of the tarsus and stifle to rule out bony abnormalities as the sole cause of lameness. Option C. Perform a comprehensive physical examination, including palpation and flexion tests, followed by targeted diagnostic analgesia to localize the lameness before considering advanced imaging. Option D. Immediately schedule the horse for a magnetic resonance imaging (MRI) scan of the entire hind limb to obtain detailed soft tissue and bone visualization. The correct answer is C. Perform a comprehensive physical examination, including palpation and flexion tests, followed by targeted diagnostic analgesia to localize the lameness before considering advanced imaging. Explanation: scenario analysis. This scenario presents a common challenge in equine diagnostics where multiple imaging modalities can be used to assess a lameness issue. The professional challenge lies in selecting the most appropriate and cost-effective diagnostic technique that provides sufficient diagnostic information for accurate diagnosis and treatment planning, while also considering the horse's welfare and the owner's financial constraints. The VTS equine must balance the desire for comprehensive information with the practical realities of veterinary practice. Correct approach analysis. Utilizing a combination of palpation, flexion tests, and diagnostic analgesia to localize the source of lameness before proceeding to advanced imaging is the cornerstone of sound diagnostic practice. This approach aligns with established veterinary principles and ethical guidelines that prioritize a systematic, stepwise diagnostic process. It minimizes unnecessary procedures, reduces the risk of iatrogenic injury, and ensures that advanced imaging is targeted to the most likely area of pathology. This methodical approach is implicitly supported by the AVMA principles of veterinary medical ethics, which emphasize competence and responsible use of resources. Incorrect approach is analysis. Proceeding directly to advanced imaging, such as MRI, without a thorough physical examination and diagnostic analgesia, represents a failure to adhere to a systematic diagnostic process. This is inefficient, costly, and may lead to misinterpretation of findings if the primary source of pain is not identified. Ethically, it could be considered a failure to provide prudent and economical care. Relying solely on radiography to diagnose all causes of equine lameness is insufficient. While radiography is valuable for bone and joint assessment, it has limitations in visualizing soft tissues like tendons, ligaments, and cartilage. This incomplete diagnostic approach could lead to a misdiagnosis and inappropriate treatment, violating the principle of providing competent care. Performing a complete lameness workup, including all available advanced imaging modalities for every case, regardless of initial findings, is wasteful and potentially harmful. It disregards the principles of judicious use of diagnostic tools and can lead to unnecessary stress and discomfort for the horse, as well as significant financial burden on the owner, which is contrary to ethical practice. Professional reasoning. Professionals should employ a tiered approach to diagnostics. This involves starting with a thorough history and physical examination, including gait analysis and palpation. Next, diagnostic analgesia should be used to pinpoint the source of pain. Only then should advanced imaging be considered, with the choice of modality, radiography, ultrasound, MRI, CT, dictated by the suspected anatomical region and type of pathology identified in the earlier steps. This systematic approach ensures efficient, effective, and ethical patient care. Question 20. Cost-benefit analysis shows that, while whole blood transfusions are readily available, a horse presenting with acute, severe anemia following a traumatic injury and significant blood loss is exhibiting profound hypovolemia and critically low oxygen carrying capacity. The attending veterinarian has determined that the primary deficit is a lack of circulating red blood cells. Considering the specific functions of blood components and the horse's immediate physiological needs, which of the following blood product interventions would represent the most targeted and effective therapeutic approach to address the immediate life-threatening condition? Option A. Transfusion of whole blood to provide a comprehensive replacement of all blood elements. Option B. Intravenous administration of broad-spectrum antibiotics to combat potential secondary infection. Option C. Administration of packed red blood cells to restore oxygen carrying capacity. Option D. Infusion of fresh frozen plasma to replenish clotting factors and oncotic pressure. The correct answer is C. Administration of packed red blood cells to restore oxygen carrying capacity. Explanation. Scenario analysis. This scenario presents a common challenge in equine veterinary practice, where a veterinarian must make critical decisions regarding blood product transfusion for a critically ill horse. The challenge lies in balancing the immediate need for life-saving intervention with the availability, cost, and potential risks associated with different blood components. The veterinarian must possess a thorough understanding of the specific functions of each blood component to select the most appropriate and effective treatment, considering the horse's clinical presentation and the economic realities faced by the owner. This requires not only scientific knowledge, but also strong communication and ethical reasoning skills. Correct approach analysis. The correct approach involves a comprehensive assessment of the horse's specific deficits and the targeted administration of the most appropriate blood component. For a horse experiencing severe anemia due to hemorrhage, packed red blood cells are indicated to restore oxygen carrying capacity. This directly addresses the primary physiological derangement and is the most effective way to improve tissue oxygenation and support vital organ function. This aligns with the ethical imperative to provide the best possible care within the owner's financial constraints, prioritizing life-saving interventions. Regulatory frameworks for veterinary practice emphasize evidence-based medicine and the judicious use of resources. Incorrect approaches analysis. Administering whole blood when only red blood cell mass is deficient is inefficient and potentially introduces unnecessary volume and other components that may not be beneficial or could even be detrimental. This represents a failure in applying specific knowledge of blood component function and could be considered a deviation from best practice, potentially leading to unnecessary risks or costs for the owner. Focusing solely on plasma transfusions for severe anemia without addressing the red blood cell deficit fails to correct the primary problem of oxygen delivery. While plasma is crucial for coagulation and oncotic pressure, it does not carry oxygen. This approach demonstrates a misunderstanding of the fundamental role of red blood cells in oxygen transport and would be a significant ethical and professional failing, potentially leading to the horse's death due to inadequate oxygenation. Recommending a broad-spectrum antibiotic infusion without a confirmed or suspected bacterial infection is inappropriate and does not address the underlying cause of anemia or hypovolemia. Antibiotics are not a blood component, and their administration in this context would be a misapplication of treatment, potentially contributing to antimicrobial resistance and incurring unnecessary costs without therapeutic benefit. This represents a failure to adhere to principles of rational drug therapy and could be seen as a breach of professional responsibility. Professional reasoning. Professionals should approach such scenarios by first performing a thorough diagnostic workup to identify the specific physiological derangements. This includes evaluating hematocrit/hemoglobin, total protein, coagulation parameters, and assessing for signs of active bleeding or other underlying causes. Based on these findings, the veterinarian should then consider the available blood products and their specific indications. A clear and transparent discussion with the owner regarding the diagnosis, treatment options, associated risks, benefits, and costs is paramount. This decision-making process prioritizes patient welfare, evidence-based medicine, and ethical considerations, ensuring that the chosen intervention is both medically appropriate and economically feasible.